My name is Andrea Stark, and I have been a provider at Palm Beach Pediatrics, now the legacy for Bluebird Kids Health, since 2000. So I've been here for 25 years. I always loved working with children. I did it in all sorts of different capacities. I was a camp counselor, I was a Sunday school teacher, I was a babysitter. I just always had something in my life was something towards children. So I started off as a peds nurse at All Children's Hospital in St. Petersburg, and I really enjoyed that. But I worked in the ICU, and I saw a lot of things there that I knew could be prevented, and that's why I wanted to become a practitioner. I saw, accidents that were happening and illnesses that weren't being managed properly, that these kids didn't need to be where they were. They didn't need to be as sick as they were. And so I wanted to go into prevention, and that's why I became a practitioner, because I really felt like parents needed education and kids needed resources to learn so that they could not get as sick as they were or have the accidents happen. So as a prevention. I could say two of those, I would say. One of them is I really enjoy behavioral health. I do enjoy behavioral health. In fact, I have a certification as a mental health specialist through the Nurse Practitioner Board. So I do enjoy behavioral health a lot. I really enjoy ADHD. That's one area that I feel like I have a lot of both personal and professional experience in. I love helping families with their children with ADHD and just giving them a lot of tips that I have learned as a parent and tips I have learned as a professional. And most of them are very bright kids and they just need a little help. So that's one area. I would say the other one is probably asthma, respiratory issues. It's something I have read a lot about and studied a lot and researched a lot, and over the years seen a lot of children who can live very normal lives with pretty severe asthma. So asthma is another area, or respiratory issues, I'd say, is the other one. I think what I love most about working with kids and families is watching their growth over time. Because I have been here for such a long time, for 25 years, I've seen a lot of babies grow into toddlers, grow into children, and become great teenagers and young adults. And just being able to have that relationship with the kids and the families and watching them just become so independent and successful is just wonderful. It's just been the greatest part. I think showing that I have a lot of empathy for them and that we've all been overwhelmed at times with parenting. I think it's important for them to know that they're not alone and there's a lot of support out there for them. If their child happens to have some kind of chronic disease, I often will ask them if it's okay if I connect them with another parent with a child that also has the same illness, so that they have someone they can go to, someone that has been there, done that, and really understands their situation. You can be successful, like this will work, but you have to put the work in.